Good morning, everyone. My name is Simran Kadil, and this is my student ID. My student number is 2213795 In this oral presentation, I will be analyzing the case study of Mrs. Teresita Manalo, who is experiencing an embolic stroke with decreased level of consciousness, slurred speech, and left-sided weakness. I will address the A to E assessment of Mrs. Manalo, her vital signs, and explain how this finding inform my clinical decision making. In addition, I will outline the rationale for 4 high-priority nursing interventions along with key medications using the case study of Mrs. Manalo, who has also experienced an embolic stroke. To begin with question 1, I will discuss the A to E assessment for Mrs. Manalo. The A to E framework supports a structured evidence-based approach to detect life-threatening condition early and guide intervention, as described by Inglis and colleague 2022. Starting with airway, Mrs. Manalo's airway is documented as patent, but her slurred speech and reduced level of consciousness increases the risk of airway obstruction due to aspiration or loss of muscle tone. Therefore, continuous monitoring, suction, and airway equipment must be readily available at the bedside, as noted by Eck and colleague 2025. Moving on to breathing, her respiratory rate is elevated at 26 beats per minute, and her oxygen is 95% on room air, indicating tachypnea and hypoxia. Mrs. Manalo requires oxygen therapy at 6 liters per minute via Hudson mask at this stage to maintain SpO2 above 95%. According to Eck et al. 2025, tachypnea and shallow breathing may indicate early respiratory distress, which requires oxygen therapy and close monitoring. Adequate oxygen is critical to reduce cerebral hypoxia and prevent secondary brain injury in stroke patients. For circulation, her blood pressure is recorded at 170 by 95 mmHg and her heart rate is 132 beats per minute, which suggests hypertension and a compensatory tachycardia aimed to maintain cerebral perfusion, a response often associated with acute stroke. Therefore, BP should be closely monitored to identify any further elevation or sudden drop that increases the risk of hemorrhagic conversion or compromised cerebral perfusion, as outlined by the Stroke Foundation 2024. Under disability, her GCS score is 11, indicating neurological impairment with left-sided weakness and slurred speech. These findings highlight the need for consistent neurological observations such as GCS, limb strength, and pupil responses to detect any further deterioration. According to the Stroke Foundation 2024, a drop of 2 or more points in GCS or new focal deficit should be immediately escalated, including activation of a rapid response or stroke team. Additionally, for exposure, Mrs. Manalo is afebrile with warm, dry skin, suggesting there is no current evidence of infection or external injury. The IV cannula in the left cubital fossa is patent and infusing well, which is appropriate for maintaining venous access. However, stroke patients are at high risk of developing pressure injury, so it is crucial to maintain skin integrity and regular repositioning as immobility increases skin breakdown. Exposure also includes examining for any bruises, rashes, or medical devices that may contribute to complications. Therefore, regular assessment on the IV side and prevention of infection are integral part of holistic person-centered care in the acute stroke setting, as stated by the Stroke Foundation 2024. Moving on to the second question, I will outline the 4 nursing priority for Mrs. Manalo's embolic stroke supported by evidence-based rationales. The first intervention is to position the patient in a semi-fowler position to optimize cerebral perfusion and reduce aspiration risk. Literature supports that upright positioning helps in airway management and oxygenation. Additionally, keeping the patient nil by mouth is also important until a formal swallow assessment is completed in stroke patients, as supported by Crow and Smith 2023. The second intervention is initiating regular neurological observations and continuous cardiac monitoring, such as ECG, telemetry, to identify any neurological deterioration or arrhythmias early. Therefore, prompt detection guides urgent intervention as an escalation, as recommended by Heron and colleague 2024. The third intervention is activating the stroke team and arranging an urgent CT scan to confirm whether the stroke is ischemic or hemorrhagic, as the treatment approach between the two is significantly different. Therefore, prompt imaging helps determine whether the patient is eligible for thrombolysis or thrombectomy, as discussed by Crow and Smith 2023. These treatments are time-critical intervention proven to improve outcomes when administered early. Finally, the fourth intervention is to coordinate medication and laboratory investigation, including monitoring coagulation profile, such as APTT-INR, platelets, and administering prescribed anticoagulant or antiplatelet therapy as ordered to prevent further clot formation and minimize the risk of reoccurring embolic events. This is significant as evidence-based guidelines highlight the importance of pharmacological management and rapid lab results to guide clinical decision and reduce secondary stroke risk, as highlighted by Huron et al. 2024. For question number 3, I have selected 3 medications to discuss in relation to Mrs. Manalo's care. For each medication, I will outline the key nursing consideration, focusing on assessment requirements, safe administration, and potential side effect. The 3 medications I will be discussing are as follows. Firstly, Alteplase is a thrombolytic agent that dissolves clot in patients with acute ischemic stroke, as noted by Inglis and colleagues 2022. Before administering, I would assess the patient for contraindication, including bleeding, recent surgery, or uncontrolled hypertension. During administration, Alteplase is given via IV infusion in a monitored environment by following the protocol dosing guidelines. I would then clearly monitor the patient's neurological status before and after administration. The side effects of this medication include bleeding, headache, or hypotension. And immediate reporting of any adverse reaction remains crucial, as mentioned by Inglis et al. 2022. Similarly, the second medication is heparin, which is an anticoagulant used to prevent further clot formation. The nursing consideration while administering this medication is to monitor the patient's activated partial thromboplastin time, also known as APTT, and platelet count to ensure safe and therapeutic levels. It can be administered intravenously via an infusion pump or subcutaneously, following the correct dosing instruction. The patient should be educated to report any bruising or bleeding and should be observed for any signs of bleeding, heparin-induced thrombocytopenia, or hyperkalemia, according to MIMS 2024. Finally, metoprolol 50 mg twice daily is a beta blocker used to control heart rate and blood pressure, as Morris and Dunham 2024 explain. Before giving this medication, it is crucial to assess blood pressure and heart rate and monitor for any sign of heart failure, such as shortness of breath. It should be administered with food to prevent gastrointestinal upset. It is given orally, ensuring the tablet is swallowed whole, and the patient should be educated to strictly follow the dosing schedule. The common side effects of these medications include fatigue, dizziness, or GI upset, and as Morris and Dunham 2024 highlight, it can also cause severe effects such as bradycardia, hypotension, or worsening heart failure. Therefore, patient must be educated to report any severe symptoms. Now, to conclude my presentation, Mrs. Manalo requires timely assessment, evidence-based intervention, and safe medication management to help achieve the best possible outcomes. Here are the list of the references that I have used to support my presentation today. Thank you everyone for listening. Thank you.